Breast cancer rehabilitation. This week I had a lady come in looking for a compression sleeve for her travel overseas. So while she was there, I asked her how her movement was going and she said, fine, it was good movement. And so I thought, I'll double check. Why are you here? So put her on her side and then asked her to reach out the back. By laying on your side on the bed and reaching, let's just say at shoulder height, and reach out the back. And the second test is a little bit higher, reach out the back. And the third test is a little bit higher again and reach out the back. Now, I would expect if we have perfect movement that the right side is the same as the left side. And on the side that she had had her breast cancer, it was restricted by a good, measuring to the bed, about a good 2 foot. So she had a significant difference between the treated side and the not treated side, but came in and felt that she had good movement. So I think that the definition of good movement changes. And so yes, she could reach up beside her ear, but reach out the back movements are often forgotten about. Now, when she did this, she said, yes, that's right, I do have trouble in doing some yoga exercises. Maybe we don't do those sort of reach out the back exercises to detect any movement problems. But like a simple example of this would be to reach over to get the seat belt or to be able to reach back and do the bra up. So there's some examples of why we need to be able to reach out the back. Now, in a very quick session, which was half an hour, where we worked out the compression garment that she needed for the flight, we were able to assess movement problems and be able to treat the movement problem. So it doesn't take long to be able to do this. So if you at home can use that reach out the back test, then it gives you an idea on whether you do have a movement restriction. And in this instance, a simple training technique of muscle release was able to get the right arm exactly the same as the left arm. So in this instance, she did think that she had good movement. And in those other occasions where she felt that the movement was restricted, kind of thought that it was due to scar tissue. But it was a simple muscle tightness that was the problem. And the muscle tightness was probably the response to the surgery or the response to the radiotherapy. But it was readily remedied. If you've got a difference between your right and left arm in reach or reach out the back, then I suggest that you contact your local breast cancer center, because there'll be therapists there that know the techniques that can be used that best help women after breast cancer.